All right. So, good evening, everyone. My name is Mila, and it's my pleasure to introduce David as the speaker tonight. And let me introduce him. David has four master degrees. David is a retired U.S. Air Force colonel, and David has served as a senior program manager for the Alaska Federal Health Care Partnership Home Telehealth Monitoring Program, which was named the most outstanding peer health program in the United States in 2011. And Dave leads Alaska Clinical Outcomes Improvement Project and represent Alaska to the Institutes of Healthcare Improvements during the 100,000 Lives Saved campaign and the Recreation Hospital Care Program. And he directed Alaska eHealth Network federal funding health information technology meaningful use program that motivate and aid medical practitioner and practice and hospitals like electronic medical record systems and achieve meaningful use certification from the U.S. Department of Health and Human Services. David is here today to talk to us today on bone health and rigorous bones. Now over to you, Dave.
Thank you, Mila. I appreciate it very much. It's a kind introduction. Today, we're going to talk about what you to know, what you can do, and what you should do about it for bone loss, bone health, and bone growth. We'll start out with Dr. Wentz's vision. I dream of a world free of pain and suffering. I dream of a world free of disease. The USANA family will be the healthiest family on earth. Share my vision, love life, and live it to the fullest in happiness and health. And that is essentially where we're going with this, is we need to make sure that our skeleton is healthy in order to be free from pain and suffering. From birth until about age 20, the bones grow and they reserve calcium. At the same time and under circumstances, every bone is undergoing continuous changes and breaking down and building up. During childhood and adolescence, bones are sculpted by a process called modeling. Modeling allows for the formation of new bone at one site and the removal of bone or old bone from another site in the same bone. This modeling process allows individual bones to grow and to shift in space. These rapid continuous changes require the metabolism of calcium to maintain the healthy state of the bone. The term osteo means relating to bone. Special cells called osteoblasts are responsible for the buildup of bone. Other cells, called osteoclasts, are responsible for bone breakdown. Build up and break down are kept at a harmonized speed so that there is a good balance between two dynamic mechanisms. The balance is most commonly affected when the breakdown or resorption mechanisms exceed the growth or restoration processes, or when osteoclasts exceed osteoblasts. Causes behind the transition between growing and decreasing bone include aging, lack of use, nutritional depletion, vitamin D deficiency, and diseases. Given good health, good nutrition, and freedom from major diseases, aging becomes the most unquestionable cause of bone loss. Loss of bone mass leads to the development of structural abnormalities that make the skeleton more fragile. Osteoporosis is the most common bone disease. It begins early and typically does not manifest visually until later in life. This is when bone loss becomes obvious due to bone breakdown and decreased levels of bone formation. Reserving calcium in bone early in life is especially important for women. Calcium intake during youth and adolescence is essential to avoiding osteoporosis until very much later in life. Age increases the prevalence of osteoporosis and its associated complications. People who are short, female, and white or Asian are more likely to have bone trouble. Osteoporosis is responsible for over 1.5 million fractures in the United States each year. It is estimated that these fractures cost upwards of $17.9 billion annually. Osteoporosis can be devastating in an elderly person. A pelvis fraction while getting out of bed, a fractured humerus sustained in brushing against a door, and the more typical compression fractures of the spine and fractures of the hip frequently lead to the need for institutional care and are associated with increased morbidity and mortality. Even a harsh cough could end up cracking or even breaking ribs in someone who has pronounced osteoporosis. Almost 1/4 of the patients aged over 50 years old will die within 1 year of a hip fracture. Bone mass declines progressively with advancing age, regardless of gender. When the rate of bone resorption due to increased osteoclast activity exceeds the rate at which osteoblasts are forming new bone, results in the depletion of calcium, collagen, and protein from the bone, increased porosity, and an accompanying increased risk of fracture. Without supplementation, bone mass starts declining progressively from the age of about 30 years old. Bone loss is greater in women than in men and is accelerated in the 5 to 7 years after menopause. Women may lose calcium from their bones when they're pregnant and breastfeeding, and they might never rebuild that reserve again. This is incredibly important lesson for prenatal women to understand. A woman's body is designed to sacrifice itself for the sake of the baby's health. A woman's body will eat itself to feed her child if she is not properly nourishing herself. Increased longevity will inevitably be associated with the increase in the incidence of osteoporosis, its associated complications, and incurred healthcare costs. That is, as people begin to live longer, osteoporosis will become more prevalent in the population because it occurs because of age. Current pharmacological approaches to osteoporosis are directed at those who already have the disease or are destined to develop the disease. This is often too little, too late for the aged person with osteoporosis. The ideal therapy for osteoporosis needs to be early prevention to establish calcium reserves in your bone, be able to replace bone loss, and to decrease bone resorption. This is a lifelong pursuit. Just going to talk a little bit about eating disorders, which are the most common in women and create a near constant state of undernourishment. People who have bulimia lose nutrients through purging. People who have anorexia do not get enough nutrients because of undereating. In both cases, the body pulls calcium from the bones. Eating disorders cause bones to weaken. And we talk about dental bone loss. And dental bone is lost from around the tooth is usually due to gum disease. Gum disease, like periodontitis, eventually makes teeth loose and fall out. It used to be thought that regrowing dental bone around teeth was impossible. That is no longer true. This was due to not being able to make periodontal ligament grow. And we're going to talk more about bone loss around your teeth later in the presentation. Diabetes also contributes to an increase in the risk of bone loss. Diabetes is a disease that is caused by the impairment of insulin production, which is type 1, or resistance to insulin, which is type 2. Both types of diabetes have effects on oral health. People suffering from diabetes often have severe gum problems that can result in dental bone loss. With the diabetes, people with diabetes are hyperglycemic and have elevated blood sugar levels. This promotes the growth of bacteria responsible for bone loss. People with diabetes have impaired host defenses because their white cells are weakened, making them more prone to infections and diseases. So we'll talk some bone basics now. Bone is composed of a harder outer shell and a spongy matrix of inner tissues and is a living substance. Bone is a composite material consisting of crystals of mineral bound to protein. This provides both strength and resilience so that the skeleton can absorb impact without breaking. A structure made only of mineral would be more brittle and break more easily. A structure made only of protein would be soft and bend too easily. The mineral phase of bone consists of small crystals containing calcium and phosphorus. This mineral is bound in an orderly manner to a matrix that is made up largely of a single protein, collagen. Collagen is made by bone cells and is assembled in long, thin rods containing 3 intertwined protein chains, which are then assembled into large fibers that are strengthened by chemical connections between them. Other proteins in bone help strengthen the collagen matrix even further and to regulate its ability to bind the minerals. Bone cells regenerate at a remarkable rate. The skeleton is replaced every 2 to 12 years. Our skeletons completely replace themselves many times in our life, and the speed of that replacement depends on our age, or the age our bones think they are, and what and how well you feed your bones. Generally, bone replacement occurs quicker when you are young and slows with age. The amount and quality of your nutrition plays a big part in determining the physical age your bones think they are. The better they are fed and exercised, the slower they age. The mechanical loading of a skeleton is essential for maintenance of normal bone mass and architecture. In addition, the skeleton needs certain nutritional elements to build tissue. Not only does the skeleton require the same nutritional elements as the rest of the body, it also has the special requirement for large amounts of calcium and phosphorus. While adequate levels of these minerals can be obtained from the mother during pregnancy and nursing, they must come from the diet thereafter. Skeletal growth is its response to mechanical forces. That is, in order for the bone to grow, you must exercise it. You must put stress and strain on it. Stress to pull it apart, strain to push it together. In order to have this motion is what causes the bones to grow and take the nutrients and put them to use into building stronger bones and bigger bones. The skeleton is also a mineral storehouse. This storehouse is dependent upon the proper functioning of a number of systemic and circulating hormones produced outside the skeleton that work in concert with local regulatory factors. The systemic hormones affect the supply of calcium and phosphorus and the formation and breakdown of bone. This complex system of regulatory hormones responds to changes in blood calcium and phosphorus, acting not only on the bone but also on other tissues, such as the intestine and the kidney. Under normal conditions, only part of dietary calcium is absorbed, and much of the calcium is left in the intestinal tract. Normally, only a small portion of the dietary calcium actually enters into the bloodstream. Now, vitamin D3 regulates the amount of dietary calcium absorbed into the body. The more vitamin D3, the more calcium is available to the body. When calcium and phosphorus are in short supply in other parts of the body, the regulating hormones will take them out of the bone and serve those vital functions in other systems of the body. Too many withdrawals weaken the bone. The regulatory hormones also play critical roles in determining how much bone is formed at different phases of skeletal growth and how well bone strength and mass is maintained throughout life. For example, sex hormones and growth hormones are increased during puberty, a time of rapid increased skeletal growth. It is important to remember that the effects of hormones and mechanical forces on the skeleton are intricately linked. The ability of bone to respond to mechanical loading is impaired with reduced estrogen production. Without regeneration, bones weakened by fracture, mechanical stress, or disease would never fully mend. However, bones do grow and regenerate, and these regions grow and repair to be stronger than ever. This constant regeneration and turnover make every day a new opportunity to make and help your skeleton. So it is never too late to improve the diet, to exercise to strengthen and protect your bone health. During the skeleton's remodeling, the body releases calcium from the bone into the bloodstream to make an individual's metabolic needs, allowing the bone to alter size and shape as it grows and repairs itself from damage and disease. This remodeling is regulated by osteoblasts and osteoclasts. Osteoblasts, again, are the cells that build up the skeleton. Osteoclasts are the cells that break down the skeleton. Osteoblasts build, osteoclasts break down. As long as the bone forming activity, or absorption, is greater than the breakdown of the bone, resorption, the process of maintaining a healthy bone structure is maintained. Even though bones stop growing in length before age 20, cells are actively repairing and replacing themselves every day. The best way to protect your bones is to fortify them with healthy habits. Diet and exercise are two of the best ways to help maintain your bone health. Exercise is one of the most effective prevention methods for osteoporosis. Teens and adults that are active, along with having a good diet, will have beautifully strong bones. This is because their bones grow to respond to impact and stress during weight-bearing exercises like running, lifting, biking, and climbing to endure the force of the activity. As a result, active people will have the strongest bones. However, nutrition and exercise cannot fix stupid. So stop smoking and make sure you make good life and diet choices. The U.S. Preventative Services Task Force recommends that women aged 65 and older be screened for osteoporosis with a bone density test. Women under age 65 with increased risk for osteoporosis should also be tested. A bone density test compares your bone density to the bones of an average healthy young adult. known as a T-score. The results will tell you how strong your bones are, whether you have osteoporosis or osteopenia, and your risk of having a fracture. Teeth. Bones and teeth. Even though they lack collagen, teeth still manage to be stronger than bone. Teeth are the hardest part of the body and are made primarily of a protein called dentin. Dentin is covered completely by a hard tooth enamel, and it is this enamel that makes the teeth strong. And remember, I was talking about exercising is absolutely necessary for bone health and bone growth. The jawbone is mostly exercised by chewing. Of course, listening exercise is your jaw more than talking. Even though it's called jawing, you listen because you clench your teeth more when you're listening. Bones and teeth have a lot in common. They are both hard, white, and packed with calcium. Both are considered part of the skeletal system, but teeth are not bones. There are a few differences that distinguish them. Teeth do not have the regenerative powers of bone tissue. Teeth are unable to heal themselves when broken. Bones have a network of cells at their disposal designed to heal cracks and make them stronger. Healthy bone requires not only sufficient quantities of calcium and vitamin D, it also requires sufficient amounts of vitamin C, lysine, proline, amino acids. It also needs proteins and other micronutrients that support the structure of collagen. By far, the most valuable mineral to your bones and teeth is calcium. Your body needs calcium to build strong bones and teeth. Calcium loss is the reason osteoporosis develops. Your body uses your bones as storage of calcium, and it draws calcium out of your bones as it's needed. When you have good reserve of calcium in your bones, your body can get what it needs without causing your bones to suffer. Calcium also plays a role in nerve transmissions, muscle function, including that of the heart, and hormone secretion. The Institute of Medicine recommends adults consume 1,000 to 1,200 milligrams of calcium per day. Non-supplemental sources of calcium include dairy products like milk, yogurt, and cheese. It also includes soft-boned fish. It is also found in green leafy vegetables like kale, broccoli, and cabbage. An adequate calcium dietary intake can significantly reduce the loss of bone. Adequate dietary intake of calcium is necessary to replenish the compulsory daily calcium losses. When calcium stores are lacking, your body pulls it from your bones to use elsewhere. To safeguard your bones, eat a diet rich in calcium. Please note that some foods make it difficult for your body to absorb calcium. Soda and other carbonated beverages decrease the amount of calcium absorbed by the intestines. We typically don't get enough magnesium in our diets alone, which creates an unbalanced ratio of calcium to magnesium in our bodies. You need a healthy combination of calcium, magnesium, and vitamin D3 to not only maintain strong, healthy bones and teeth, but also support cardiovascular and metabolic health. Magnesium improves bone quality. Besides being one of the minerals found in bone, magnesium stimulates the thyroid to secrete calcitonin. Calcitonin is a hormone that helps preserve bone strength by channeling calcium from the bloodstream to your bones. Not only does magnesium help strengthen your bones, magnesium influences the type of cells, the osteoblasts and the osteoclasts, the body needs for bone growth and repair. A magnesium deficiency can directly affect bone by altering the structure and size of the bone crystals. Magnesium deficiencies are associated with reduced concentrations of both parathyroid hormone, PTH, and the active form of vitamin D3, which regulates bone homeostasis. Your body needs magnesium to support more than 300 biochemical reactions. Magnesium supports muscle and nerve function. It keeps your heart beating regularly, builds strong bones, and boosts your immunity. The Institute of Medicine recommends adult women consume 310 to 320 milligrams per day, while men need 400 to 420 milligrams per day. Beans, nuts, whole grains, green vegetables serve as good sources of magnesium. Magnesium deficiencies are associated with an increase in inflammatory proteins that negatively affect bone remodeling. Magnesium deficiencies negatively affect blood flow that is necessary for bone health. A deficiency of magnesium can influence the body's buffering capacity, resulting in low-grade acidosis. Metabolic acidosis has been shown to lead to calcium loss from bone and to impair bone mineralization. Vitamin D3 is also a critical player in bone health. Primary prevention of osteoporosis is calcium and vitamin D that optimize peak bone mass, thereby maximizing the buffer available before bone demineralization affects structural integrity. This can slow the natural rate of bone demineralization so that existing structure integrity is conserved as much as possible and as far into late life as is possible. Vitamin D3 keeps your bones strong by helping you absorb calcium and other minerals from the intestines into the bloodstream and move it to where it's needed. Vitamin D3 also aids the resorption of calcium by the kidney. Some foods and dietary products that say they are vitamin D enriched are really fortified with vitamin D2 and not vitamin D3. So please check your label. Vitamin D3 deficiency decreases calcium absorption from the intestinal tract and the kidneys, increases parathyroid hormone concentration, and leads to osteoporosis, which over time may lead to a life-threatening fracture. Vitamin D3 should not technically be called a vitamin. It is not an essential food element and can be made by the action of ultraviolet light from the sun on cholesterol in the skin. However, many people have diets or lack sun exposure causing insufficient vitamin D and thus do not absorb enough calcium. Many people need vitamin D supplementation in their diet because they do not derive adequate levels of exposure to the sun. People who spend their days indoors, wear clothes, or live in higher northern or southern latitudes where the sun's rays are filtered out in winter and have substantial inclement weather do not make sufficient vitamin D in their skin. People with darker pigmented skin are naturally resistant to the sun and thus are also at risk of not getting enough vitamin D3 from the sun. This is exasperated if they have moved into areas of less sunshine. Other people should also supplement vitamin D3, especially if they are properly using sunscreen to avoid damaging results of sun exposure. I was just a touch base on that. You want to use sunscreen in order to protect your skin from the damaging rays of the sun. If you use sunscreen, you're also diminishing your ability of your skin to create vitamin D3. In the balance, it is easier to supplement vitamin D3 than eliminate your sunscreen. I'll say it again. It is better to use sunscreen and supplement vitamin D3 than to not use sunscreen. Vitamin K2 is a promoter of bone and cardiovascular health. Vitamin K2 keeps your bones and cardiovascular function strong. Long-acting vitamin K2 makes sure calcium goes to where it belongs. Inadequate calcium intake can lead to decreased bone mineral density, which can increase the risk of bone fractures. Supplemental calcium promotes bone mineral density and strengthens and can prevent osteoporosis. Scientific evidence suggests that elevated consumption of calcium supplements may raise the risk of heart disease and can be connected with accelerated deposit of calcium in blood vessel walls and soft tissues. To the rescue, K2 is associated with the inhibition of arterial calcification and arterial stiffening. An adequate intake of vitamin K2 has been shown to lower the risk of vascular damage because it activates the matrix GLA protein, which inhibits the deposits of calcium on vessel walls. Vitamin K, particularly as vitamin K2, is nearly non-existent in junk food, so there is little K2 being consumed in the Western diet. I guess what I'm saying here is that you really need to supplement with vitamin K2, and here's why. By striking the right balance of calcium and vitamin K2, it may be possible to fight osteoporosis and simultaneously prevent the calcification and stiffening of the arteries. Studies revealed that high dietary intake of vitamin K2, at least 32 micrograms per day, with no intake of vitamin K1, was associated with a 50% reduction in death from cardiovascular issues related to arterial calcification and 25% reduction in all-cause mortality. If at least 32 micrograms of vitamin K2 is present in the diet, then the risks of blood vessel calcification and heart problems are significantly lowered and the elasticity of the vessel wall is increased. One recent double-blind randomized clinical trial investigated the effects of supplemental K2 with a 3-year period for a group of 244 postmenopausal Dutch women. The researchers found that the daily dose of 180 micrograms was enough to improve mineral density, bone strength, and cardiovascular health. They also showed that achieving a clinically relevant improvement required at least 2 years of supplementation. It's not a magic pill. You got to do it and do it and do it and do it. Okay? You start, you take it, you take it, you take it. You're protecting yourself throughout your life. Remember that calcium is a lifetime journey. It's not just something that you need to do late in life. Vitamin K2 in tandem with calcium supplementation may solve the dilemma of bringing necessary bone benefits of calcium while circumventing an increase in calcium risk for heart disease. You can increase your vitamin K2 intake by either taking the USANA Cell Essentials, which includes 30 micrograms of vitamin K2, and by taking USANA's separate K2 optimizer tablet, which has 180 micrograms of K2. Additionally, vitamin B12 deficiency is associated with reduced bone development and maintenance. Copper deficiency is linked to cartilage and bone disorders. Zinc deficiency during growth reduces peak bone density. I like to go into proteins because it's more about half of your bone structure is made up of protein. Proteins represent approximately 30% of the bone's mass, so 50% of the bone itself and 30% of its actual weight. Okay, bone metabolism is dependent upon dietary intake of protein. When you have a fracture, your body needs it to build new bone for the repair. It also helps your body to intake and use calcium. Evidence exists that soy protein extracts and its constituents can influence bone mass. Collagen is a protein, an important building block for bone. Collagen builds bones to withstand tension and pressure. Collagen is considered the scaffolding of the bone. About 90% of the scaffolding matrix are collagen proteins, which is the most abundant protein in the body. Collagen is very strong and forms bone, cartilage, skin, and tendons. Vitamin C and amino acids help your body make collagen. Vitamin C is an important first line of defense in protecting biomolecules from oxidative damage and especially in circulation. However, the concentrations of vitamin C in the body are tightly regulated by intestinal absorption from the diet and recycling by the kidneys. Because of this tight regulation, it was thought that circulating vitamin C levels could only be increased by supplementing with vitamin C. However, it has recently been shown that both circulating and tissue levels of vitamin C can be increased by certain phytochemicals, even in the absence of vitamin C supplementation. This was discovered during the clinical trials for USANA's liver-enhancing supplement, Hepacil. Amino acids, lysine and proline, besides their function as building blocks for proteins, amino acids have other important physiological roles, such is the case of the nonpolar amino acid proline and lysine. Proline and lysine are critical for the production of collagen. The body cannot produce lysine internally. Consequently, there is a high probability of shortage of this critical nutrient in malnutritional situations. This can further exacerbate the stress caused by a bone fracture or disease. Now, the USANA Health Pack includes all of these minerals, micro, macronutrients, vitamins, including K2, antioxidants, plus USANA's comprehensive bone health supplement called MagnaCal D. MagnaCal D combines magnesium, calcium, and vitamin D in a full body support. We typically do not get enough magnesium in our diets alone, which creates an unbalanced ratio of calcium to magnesium, says USANA Executive Director for Global Research and Development, Dr. John Como. We're excited to give consumers an optimum combination of calcium, magnesium, and vitamin D to not only maintain strong, healthy bones and teeth, but also supplement and support cardiovascular and metabolic health. USANA's Health Pack is an all-encompassing bone health supplement that combines optimum amounts of magnesium, calcium, and vitamin D to help individuals maintain a strong and healthy bones and skeletal system. We had found that people were consuming plenty of calcium, but were getting less than the recommended amounts of magnesium and vitamin D. This gave us the unique impetus to formulate a supplement to balance out the body's levels of calcium, magnesium, and vitamin D, says USANA Chief Scientific Officer Dr. Robert Sano. Through the direction of USANA's founder, Dr. Myron Wentz, we calculated the perfect ratio of calcium to magnesium and advanced levels of vitamin D that you'll find in the MagnaCal D supplement. USANA's MagnaCal D supplement helps restore a better balance of these nutrients in your body and supports your health better than products with low or no magnesium or vitamin D. MagnaCal D also is designed to work seamlessly as a core optimizer for USANA's flagship triple-action cellular nutritional system called Cellsentials. Remember we talked about estrogen and the sex hormones? Estrogens help regulate the rate of bone formation and bone resorption in women, and estrogen is also necessary for bone strength in males. This estrogen is important for bones of men as well as women. In fact, older men normally have higher levels of circulating estrogen than do postmenopausal women. Hormone imbalances are linked to osteoporosis. Estrogen acts on both osteoclasts and osteoblasts to inhibit bone breakdown at all stages in life. The estrogen produced in children and during early puberty increases bone growth and calcium banking in bone. The high concentration of estrogen that occurs at the end of puberty has a special effect. It stops the further growth in height by closing the cartilage plates at the ends of the bone that previously had allowed these bones to lengthen. The marked decrease in estrogen at menopause is associated with rapid bone loss. You should ask your doctor to test your hormones as you reach middle age to see if you need supplementation to help protect your bones. Hormone therapy was widely used to prevent osteoporosis, but this practice is controversial because of the risks of increased breast cancer, strokes, blood clots, and cardiovascular disease, leading to more emphasis on early prevention through early and continuous nutritional supplementation. Androgens, such as testosterone, are necessary for bone strength in males and may also increase bone formation in females. Testosterone is important for skeletal growth both because of its direct effect on bone and its ability to stimulate the growth of muscle growth, which puts greater stress on the bone and thus increases bone formation. Testosterone is also a source of estrogen in the body. Testosterone is converted into estrogen in fat cells. Calcitonin is a hormone that helps preserve bone strength by channeling calcium from your bloodstream to your bones. Calcitonin is a calcium-regulating hormone produced by cells of the thyroid gland. Calcitonin is formed by different cells than those that produce thyroid hormones. Calcitonin can block bone breakdown by inactivating osteoclasts, but this effect may be relatively transient in adults. The parathyroid hormone, or PTH, is produced by 4 small glands adjacent to the thyroid gland. These glands precisely control the level of calcium in the blood. They are sensitive to small changes in calcium concentration so that when calcium concentration decreases, even slightly, the secretion of PTH increases. PTH acts on the kidney to conserve calcium and to stimulate calcitrol production, which increases intestinal absorption of calcium. PTH also acts on the bone to increase movement of calcium from bone to blood. Excessive production of PTH is called hyperparathyroidism and can lead to bone loss. PTH stimulates bone formation as well as resorption. When small amounts are injected intermittently, bone formation predominates and the bones get stronger. This is the basis of a new treatment for osteoporosis. Parathyroid-related protein is a second hormone related to PTH, normally regulates cartilage and bone development in the fetus. If it's overproduced by individuals, it can have who have certain types of cancer. It can cause excessive bone breakdown and abnormally high blood calcium levels. Calcitrol is the hormone produced from vitamin D3. Calcitrol is formed from vitamin D3 by enzymes in the liver and the kidney. Calcitrol acts on many different tissues, but its most important action is the increased intestinal absorption of calcium and phosphorus, thus supplying the minerals for the skeleton. D3, calcitrol, increased calcium, increased phosphorus, good for the bones. Growth hormone from the pituitary gland is also an important regulator of skeletal growth. Growth hormone is essential for growth, and it accelerates the skeletal growth at puberty. Decreased production of growth hormone with age may be responsible for the inability of older individuals to form bone rapidly and slows the replacement of bone loss by resorption. The growth hormone stimulates both the bone resorbing and bone forming cells, but the dominant effect is on bone formation, thus resulting in the increase in bone mass. Thyroid hormones increase the energy production of all body cells, including the bone cells. They increase the rates of bone formation and resorption. Deficiency of thyroid hormone can impair growth in children, while excessive amounts of thyroid hormone can cause too much bone breakdown and weaken the skeleton. Continuing the discussion of hormones, cortisol, the major hormone of the adrenal gland, is a critical regulator of metabolism and is important to the body's ability to respond to stress and injury. It is a complex effect on the skeleton. Small amounts are necessary for normal bone development, but large amounts block bone growth. Synthetic forms of cortisol, called glucocorticoids, are used to treat many diseases such as asthma and arthritis. These treatments can cause bone loss due to both a decreased bone formation and increased bone breakdown, both of which lead to high-risk fractures. Insulin is important to bone growth, and the response of other factors that stimulate bone growth is impaired in individuals with insulin deficiency. Leptin is a relatively recently discovered hormone that from fat cells has also shown to have effects on the bone. Phosphorus plays an important role in building strong bones and teeth, producing proteins the body needs, and repairing cells. Young adults and women should consume 700 milligrams of phosphorus a day, according to the Institute of Medicine. Dairy foods, meat, and whole grains are good sources of phosphorus. Whole grains. Don't look to your white bread to fix your phosphorus level. Dairy foods, meat, and whole grains are good sources of phosphorus. Phosphorus intake greater than calcium is potentially linked to bone loss. It is important to keep your phosphorus intake less than your calcium intake. The following are counterindicated. They increase the risk of fractures. Lipids. Lipids include fats, oils, waxes, phospholipids, and steroids. Also, sodium chloride. Excessive intake of sodium chloride or table salt is a risk factor for osteoporosis. Although too much sodium can increase your risk of developing high blood pressure, your body does need sodium to stimulate nerve and muscle function. You don't necessarily need to eliminate sodium, but sodium helps maintain the correct balance of fluid in the cells and supports the absorption of other nutrients, including chloride, amino acids, and glucose. Your body only requires 180 to 500 milligrams of sodium per day. This is easy to achieve from the foods you eat without adding extra salt to your diet. So quit sprinkling salt on your food. Your body will tell you if it ever needs more salt by being constantly thirsty or having salt cravings. If you must add salt, then use a potassium chloride salt and not a sodium chloride. But also keep your intake low. But too much vitamin A is also a counterindicator. That is, greater than 3,000 international units or IUs per kilogram for adults. Hypervitaminosis of vitamin A can cause bone resorption and decrease bone formation. However, let's put this in perspective. One raw carrot contains 8,353 IUs of international units of vitamin A, which includes 4,142 micrograms of beta-carotene. Children who are particularly sensitive of vitamin A, with daily intakes which should be limited below 1,500 IUs per kilogram body weight per day. A 22.7 kilogram or 50-pound child should not consume more than 75,000 IUs of vitamin A per day. That is 9 whole carrots every day. Upper limits of vitamin A for adults is listed at 3,000 IUs per kilogram. A 76 kilogram or 163-pound person should not consume more than 228,000 IUs of vitamin A per day. That is the equivalent of 27.3 whole carrots. All right. Keeping everything in perspective, you need vitamin A for your eyes, you need vitamin A for an awful lot of things. Just because it's counterindicated for bone resorption or bone growth and your bones, doesn't mean you should stop taking vitamin A. Keep it in perspective. Don't give your 50-pound child more than 7 or 9 carrots per day, and yourself, if you're around 163 pounds, don't eat more than 27.3 carrots per day. Okay? So track and look at your supplementation, but make sure you're getting the right amount or the optimum amount of vitamin A in your diet. Okay, and always consider what is said, and don't take it out of character. Okay. Dental bone regrowth. In addition to the nutritional recommendations previously given for bone, and we've talked about a lot of things between nutritional and hormonic and then prevention of the counterindicators. In addition to the nutritional recommendations previously given, one of the most exciting areas in dentistry today are the treatments that stimulate the regrowing of diseased, deteriorated bone around teeth. There are now materials available to dentists that are considered breakthrough advancements in how dentists treat teeth. So if you're suffering from gum disease, it may be worth checking to see if some of the teeth can now be saved by the use of enamel matrix proteins, or EMD, to enhance bone regrowth around the roots of your teeth. This applies to such an extent that a tooth which in the past was deemed hopeless can now undergo treatment to reverse damage, making it last longer. Unfortunately, these treatments concepts cannot save all teeth, but have a spectacular result when conditions are favorable. Human teeth are comprised of 3 hard tissues: enamel, dentin, and cementin. A tooth root is normally made of dentin covered by a coating of cementin. Between the cementin and the bone is a thin layer called the periodontal ligament, which acts like a shock absorber. So when you bite, your teeth move ever so slightly in and out of the jawbone, which of course exercises the jawbone and makes the jawbone stronger. Bone may be lost around the tooth due to many different disease processes, including the most common, which is periodontal disease. Gum disease eventually makes the tooth loose and fall out. It used to be thought that regrowing bone around teeth was impossible due to not being able to make the periodontal ligament regrow. However, now there are specially designed gels containing enamel matrix proteins that trick the body into forming new bone cementin and the attached fibers or the attachment fibers. The gel's secret weapon are the EMPs that are taken from developing teeth of pigs. As unusual as it sounds, the gels are compatible with the human body and do not cause allergic reactions. When our teeth are first forming, these proteins are naturally secreted from our bodies onto the root of the surface of the teeth, which creates the environment so the teeth can attach to the bone. The same process is replicated when these EMP gels are placed on the adult teeth that have lost bone due to disease. The gel stimulates bone cells to grow and stops the cells that eat bones. Dentists assess each tooth individually to see if it would be favorable for these bone regrowth treatments. A variety of treatments that use EMP gels, both surgical and non-surgical, can cause bone to regrow. This means that loose teeth can be tightened and gum recession can be reversed. Finally, there are mechanical and electrical processes to assist in bone regrowth. These are used to stabilize and in turn stress bone to cause the nutritional and harmonic reactions to accelerate in a controlled environment bone growth. A full discussion of these tools of bone repair are best reserved for later discussion of specific cases needing them. In summary, we need to help our bodies create sufficient reserves of bone calcium at early ages and protect against rapid resorption with diet and exercise. We need to feed our bones to cause osteoblasts to exceed osteoclasts to repair and regrow bone. The most important nutritional additives for bone growth are calcium, magnesium, vitamin D3, vitamin K2, vitamin C, and protein, specifically soy protein, all of which are part of the USANA daily regimen in my household. Health Pack with MegaCal D, K2, and Poly C, vitamin K2 at 180 micrograms per pill in the optimizer, and the nutritional NutriMeal or a soy shake. So now you have what you need to know, what you can do, and why you should do it to prevent bone loss, to enhance your bone health, and to regrow bone. Thank you very much.
Oh. Wow, that's very good information. I learned a whole lot.
Yeah, well, happy that we were able to help, and we hope that those people who were able to participate in this presentation have take away an important lesson to know that bone health is a lifelong journey, and you need to concentrate on building up your bone so that as your estrogen levels decrease or your osteoclasts exceed those of your osteoblasts as you age, that they can have that reserve to pull from without causing weakness to your skeleton.
Okay, so osteoclast is increase, osteoclast is decrease. Kind of osteoclast, I remember will be clap. Probably that would be a better way to remember.
Yeah, blast is creation and clast is resorption.
Resorption. Okay.
Yeah.
And then
Yeah, and your body will take from its bone what it needs when it needs it if you're not feeding your nutritional needs for your entire body.
right. Okay. So David, in order to maintain a good bones and then also healthy teeth, to summarize that we do need to have like good calcium, good magnesium, vitamin D, K2, protein, and good hormone
Yes,
and
in order to have
phosphorus.
good hormones, you need to have all of the nutritional requirements and for fundamental health that is included in the My Health Pack, which is in the Cell Essentials with Cell Essentials Booster and the Mega Cal D supplement. So all of that is in the My Health Pack. And then you can add the K2 optimizer, and I also add the vitamin D3 optimizer to my bone health and that of Michelle's bone health regimen.
Yeah, and of course have a good exercise, build up the bone density, and taking proper nutrition, which like taking one of the Yosana health pack, which include all of that. I got it.
Mm-hmm.
Thank you so much.
All right.
Cool. Okay.
Did you see the questions that came in online? See if I can find. I pull them up here just as a second. I know we had a question from Thekla out in Washington State. I'm not seeing it right now.
Okay. If now
Okay.
if now
We'll have to address her questions offline.
All right. Well, that will conclude our bone health growth presentation today.
All right. So to all of you, good night.
Good night.